Dietary intake in MS. Well, a number of studies have been done to look at MS patients and try to address, well, okay, is there something funny about an MS patient's diet? Are there elements to their diet that they're not getting that might have some role in the disease? And so when they looked at large numbers of MS patients, this is what they found. These are basically the elements in a diet that we find are are generally lower than we see in a normal person's diet. So in general, MS patients tend to have a lower calcium intake and lower calcium levels, lower magnesium levels, lower zinc levels. And zinc levels are important because they're very important in sort of skin integrity. And patients with low zinc levels often are prone to bed sores. Folic acid is low in MS patients in general, and that can lead to anemias. And then selenium, which is an antioxidant involved in cellular health. Now, in particular, vitamin D, I didn't have it on the previous list, but one of the things that has really come up and is a hotbed of interest in the MS community is this notion that MS patients have low vitamin D levels, and this is a fact. Vitamin D is a very important vitamin that's involved in calcium metabolism, so it's involved in maintaining bone health, maintaining healthy calcium levels, which are very important in muscular contractility, and a variety of other things. Now, vitamin D deficiency, does anyone remember what that causes back in the old days, back when vitamin D? Rickets, yeah. So in the old days, rickets was very common in sort of the 1800s. Kids not getting exposed to sunlight, and they just developed these terrible bones from vitamin D deficiency. Well, vitamin D, it turns out, is very important in preventing osteoporosis, and that's what I learned in medical school, was that vitamin D basically was a calcium vitamin, and you know, we needed to worry about it for osteoporosis, but really not for much else. We know that vitamin D deficiency is common in MS. Exactly how common it is remains to be determined, but we do know that there's a link to vitamin D levels in sunlight exposure. So one of the ways we get vitamin D is by being out in the sun. The ultraviolet radiation from sunlight converts a chemical in our skin into the precursor of what will then become a metabolically active vitamin D. So vitamin D deficiency is really almost unheard of in the equatorial regions, areas of the country where people basically spend their life outdoors, but vitamin D deficiency is very common in areas like Scandinavia and northern climates where people have 6 months of midnight and really don't get any exposure to sunlight. So sunlight exposure is one source for vitamin D, but then dietary sources are also one way to mitigate that. So you can also correct for that absence of sunlight exposure by getting dietary supplementation. Now, the issue kind of arose basically out of an epidemiologic observation, and that observation was, we know MS is more common in higher latitudes and less common around the equator. We know that vitamin D levels are higher near the equator and lower near the higher latitudes like Scandinavia, Ireland, Iceland. And so somebody put 2 and 2 together and said, hey, maybe there's some kind of causal link here. Maybe one of the reasons this is more common in these higher latitudes has to do with the fact that vitamin D levels are lower. And so many studies have been done to try to assess this and get at whether the use of vitamin D might be in some way protective or therapeutic for MS. So does anyone know what EAE is? EAE is experimental allergic encephalomyelitis, and this is the animal model for MS. So when we study MS, one of the principal ways we've discovered what is going on with the immune system is by studying rats who get this form of MS called EAE. And we can induce this by taking myelin basic protein, injecting it into rats, and then their immune system reacts to that and causes the disease EAE. Well, turns out if you pre-treat rats with vitamin D and calcium, you can prevent the development of EAE. That's exactly how we discovered Copaxone works. That's exactly how we discovered that interferons work, Avonex, Betaseron, Rebif. All of these drugs came to the market because they blocked EAE. And so vitamin D does the same thing, and it does it very dramatically. So we know that vitamin D is an anti-inflammatory molecule vis-a-vis experimental MS. We also have measured a number of the chemicals that are involved in sort of promoting inflammation. So some of the interleukins and interferon gamma and a variety of these chemicals that are involved in promoting inflammation. And we find that when you treat people with high doses of vitamin D, you can actually reduce the number of those chemicals and increase the amount of chemicals that are anti-inflammatory. And so you convert a patient's immunologic appearance to go from this sort of inflammatory Th1 model into an anti-inflammatory Th2.